Hello, my name is Teresa Turner, and this is my population level health education intervention project presentation. I will be presenting my education prevention project on the community of Barrio Logan. The two health-related problems that I will discuss that I taught were on diabetes and the impact of health due to uncontrolled diabetes, and lifestyle and dietary changes needed to prevent and control diabetes. The southern part of the original Logan Heights neighborhood in central San Diego came to be called Barrio Logan. Barrio Logan is a low socioeconomic community where 92% of the population is Mexican or Chicano. 41% of the population lives below poverty. It's a known fact that people from minority populations are more likely to be affected by type 2 diabetes. Minority groups constitute 25% of all adult patients with diabetes in the United States and represent the majority of children and adolescents with type 2 diabetes. According to Healthy People 2020, the Community Preventive Services Task Force recommends diabetes disease management programs should improve the following. Glycemic control, should provide monitoring or screening for diabetes and other health problems related to diabetes, such as diabetic retinopathy, glycated hemoglobin, neuropathy, and vascular changes among the lower extremities. And also should be monitoring and screening for protein in urine and lipid concentrations. The objectives of the Healthy People 2020 were, in regards to diabetes, were lifestyle change. One of the things is lifestyle change has been proven effective in preventing or delaying the onset of type 2 diabetes in high-risk individuals. Increase prevention behaviors in persons at high risk for diabetes with pre-diabetes screening. Increase the proportion of persons at high risk for diabetes with diabetes who report increasing their levels of physical activity. Increase the proportion of persons at high risk for diabetes with pre-diabetes who report trying to lose weight. And increase the proportion of persons at high risk for diabetes with pre-diabetes who report reducing the amount of fat or calories in their diet. The needs assessment. I interviewed community stakeholders in the community, and one of the community stakeholders was an RN that worked at the Logan Heights Family Health Center. I interviewed also a 30-year resident of Barrio Logan. Both of them felt that there was a high prevalence of diabetes type 2 and a high prevalence of obesity. The 30-year resident also had diabetes type 2 and was struggling with her own obesity. The theoretical framework and needs assessment that was used was the Precede-Proceed model. The Precede-Proceed framework was developed to plan health education and health promotion intervention programs in the community setting using an educational and ecological approach. In the Precede model, the phases 1 through 4, I defined the ultimate outcome, and I used community windshield surveys and face-to-face interviews with stakeholders. And some of the things that were found were that the Barrio Logan community needs a program that helps children and adults with obesity. My focus was mainly on adults, although there were some children present. And tackling the obesity issue can prevent diabetes. The community needs to have further education regarding proper nutrition and exercise also. I also, I Phase 2 phase, the primary ethnicity of the population, just talking a little bit about the demographics, like I mentioned earlier, is Mexican and Chicano. And the diet of the Mexican culture consists of high amounts of rice, beans, lard, and corn or flour tortillas, which would be high carbs and high fat, and also some sugars. Fruits and vegetables are a small percentage of their diet. Phase 3, examining the factors that influence behavior, lifestyle, and response to the environment. The majority of the families struggle to keep food on the table, and the economic environment does not provide the availability of decent wage jobs. The barriers to learning determine an educational need regarding improper diet and lack of exercise that lead to diabetes. In phase 4, identifying resources for education intervention. Health promotion regarding diabetes are essential elements of an appropriate education intervention to promote a healthier lifestyle for the community of Barrio Logan. And coordination with the client education program at the Logan Heights Family Health Center was very attainable for me, and I was able to go to the Barrio Logan Heights Family Health Center and teach these classes to a small portion of the community. To proceed, phase 5, 6, 7, and 8, I was the implementation, the process evaluation, the impact evaluation, and the outcome evaluation. Phase 5, I developed a teaching plan, focuses on individuals and families with unmet health needs in the community. It was to preserve, protect, and promote health in this population, and also to maintain health and prevent disease. 2 health education classes were taught at the Logan Heights Family Health Center, and I discussed the causes of diabetes and the impact of health due to uncontrolled diabetes, and diet and nutrition related to diabetes. And I will discuss phase 7 and 8 a little later in the slides. The issues, education and practice. There were some barriers and there were some assets. Some of the barriers were, some of them were not open to change their lifestyle or behavior, and they had no family support to help them control their diabetes, and they were low income and they were underinsured. Some of the assets were that some of the people were open to change their lifestyle and behaviors. They wanted to decrease their weight and improve their exercise, and also control their diabetes or prevent for future diabetes by changing some of their lifestyle habits. And they also did have family support, and then they also had, that's one of the assets of this community, it does have some community resources. Again, my interventions were addressing the Healthy People 2020 objectives, and I did discuss those earlier in the earlier slides. They are still the same. My actual intervention was classes that were taught using the low literacy handouts. The topics covered were, the first class was on diabetes, pre-diabetes, and illness and what happens to the body with diabetes. The second class was on diabetes and healthy eating, diabetes and exercise, and also I gave them some information for their local community resource and for screening and diabetes management. These are a few of the handouts, exactly what I taught the class. What is diabetes? A little bit about pre-diabetes and the metabolic syndrome, the risk factors, what to look for. And here's some nutritional, this is the second class, which was on the nutritional portion. The Mexican diet, like I mentioned before, is high in sugars, fats, high in carbs, and salts. So I talked about where they could find hidden sugars, and how that affects if they have diabetes or if they're pre-diabetic, or if they are just obese and that these are some factors that can lead to diabetes in the future. So, and I also talked about the hidden fats, and the hidden salts. I talked about the diabetes and exercise. These two pages of these handouts were talking about the first steps, starting an exercise program, the goals of an exercise program, and tips on getting started. Barrio Logan does have a wonderful community resource, the Logan Heights Family Health Center, where I did this teaching, and these centers also throughout San Diego. There's one at UC San Diego. There's a few of these clinics around, and they meet the full spectrum of patients and all their wellness needs, and they treat chronic health conditions, high blood pressure, diabetes, asthma. They offer mental health services for those who may need someone to talk to, and they also they pride themselves in focusing on providing compassionate care for the entire person, the entire body. Regardless of their health condition or income status, they will treat all patients with dignity and respect. And they do have a very friendly and professional medical staff. As far as budget is concerned, I think I probably spent about $20 for paper and supplies. It was all done on a volunteer basis. No salary was given, but I did a little bit of research, just talking to different speakers and different nurses that do education. And a professional educational speaker, they usually would charge a fee of like $150 an hour. The project evaluations, goals, and objectives. Again, those were part of the impact objectives. And after this class, I wanted the community attendees to be screened for diabetes. I told them that there is free diabetes screening at this clinic. I was hoping they had a better understanding of diabetes and its implication on their health. Again, I gave them the resources for diabetes management, gave them teaching on improving their diet and exercise, and I told them they need to continue with understanding the diabetes and get diabetes education, have their controlled blood glucose levels, and keep improving on their weight loss strategies. And this in turn would lower their risk for hypertension, cardiovascular, and renal disease. The outcome measurements of success, I would say for short term, I did do some surveys and evaluations, and I got a lot of positive feedback from the class. Long term, I would like to follow up with the clinic, and I would like the continuing of case management, which will involve planning, coordinating, and providing health care for all the people in the community affected by diabetes. And I would like to follow up with the clinic to see which of the attendees did get screened, and maybe if they were diabetic, if they improved anything in their diet and exercise. Results and conclusions. The teaching intervention was successful and it went very well. The classes flowed with ease, and the attendees were very attentive. The weakness in my project, though, is that mostly they're Spanish speaking with limited English or English as a second language. In the future, if I was to do any projects at the Logan Heights Community Center, I would like it to be bilingual, and I would have handouts in English and in Spanish. And I would probably have maybe one of my colleagues that are Spanish, or I do have other nurse colleagues, friends that are Spanish, and maybe I would have them present with me as an interpreter. And these are my references, and this is the end of my presentation. Thank you.